One driver's perspective, transportation and sleep apnea.
Thank you. Well, I'm not a doctor. I've got no initials after my name other than CDL. I'm just a truck driver, but I've got a little bit of experience dealing with obstructive sleep apnea in a trucking environment. What we're going to try to do today is cover two broad areas. We've got the practical challenges that truck drivers face in their treatment. And we also have some of the psychological and job career issues that truck drivers are also dealing with. So we're going to try to cover a lot in a short period of time. To get started, I'll give you a little bit of idea of my background. I was a new hand. And again, part of what we're also going to do today is get you to talk truck a little bit. A hand is like the old cowboy days. I was a new driver back in 2000. I was what I now call a voluntary referral to treatment. My mother-in-law read an article in Reader's Digest in October 2002, gave it to my wife, and that got me in to see my general practitioner and through the sleep study. So I had a diagnostic polysomnogram Sunday night, and I returned to work Monday afternoon. So I got a call from my sleep doc on Wednesday that I was positive for sleep apnea, and they wanted to schedule a titrating study. So a couple hours after getting that call, I stopped in to see my driver manager or my supervisor in Mount Hope, Ohio, 385 miles away from home. Basically, I was fired on the spot. One of the issues that you need to understand is the regulatory environment that truck drivers work in. In 2002, any clinical diagnosis of sleep apnea was an immediately disqualifying condition for a DOT medical card. So the fact that I had driven for 2 hours after being told I had a disqualifying condition basically got me fired. Now, luckily, I worked for a major company that after some talking, they routed me back home. But I ended up off work for almost a month and absorbing the 20% uncovered insurance costs of a PSG, a titrating study, and a CPAP. So you can understand, I went through some pretty interesting times when I was first diagnosed. So again, let's get you to talk truck a little bit. First thing you need to understand is the difference between a solo driver and a team driver. I was a solo driver, one driver in the truck. Truck moves 11 hours a day, works 14 hours a day. A team truck, there are two drivers in the truck. While one drives, the other one sleeps. So that truck is moving 22 hours a day. And we'll talk about this later when we talk about CPAP. But that CPAP then is going to be used while the truck is in motion with water flow. You need to understand the difference between local and over the road. In trucking, it's called our time at home frequency. You may have someone who is a truck driver, but they're doing local and pickup delivery work in a day cab. So they're really, except for the regulatory issues, going to be no different than a normal home patient. You won't have all the power supply issues. Another thing you need to ask a truck driver patient would be, are they involved in any slip seating operations? Slip seating in trucking is where every time you come into work, you may get a different truck. So one driver drives the truck Monday to Thursday, he gets out. A new driver drives it Friday through Tuesday, he gets out. Wednesday, a different driver gets in. Remember it, semi-trucks are $120,000, $140,000 piece of equipment that a trucking company wants to keep moving 7 days a week. A driver in a slip seating operation has to have a 12-volt power supply. The other thing to ask is the truck or are any of the trucks in the driver's fleet equipped with an auxiliary power unit, APU? We'll deal with that more when we talk about power supplies. You'll hear us talking some of our slang. If I'm running Vampire, that means I work all night, sleep all day, and I get in my coffin. Sleeper bursts, if you ever see them, they're often about the size of a coffin. So you'll think that, you get your coffin come daylight. Another question to ask, especially if the driver is having problems with compliance data, is the truck equipped with optimized idle? Optimized idle is a system that when the truck is parked, the truck senses coolant pressure and battery voltage, automatically turning the engine on and off all night long. The problem for CPAP operations is that if you're running on a direct 12-volt power supply to the CPAP, when that truck starts, you're going to have a period of 6 or 7 volts. Either that will scramble and at times has burned out the compliance data cards in the CPAP, or it's going to show you that the machine was turned off and then turned back on. Depending on how the compliance data program for that make and model of CPAP works, it may not show you a proper number of hours of use unless you manually go in and add up all those little time periods. Drivers live on their hours of service, HOS. We deal with a 14-hour work, 11-hour driving, 70-hour cumulative work in an 8-day period that can be reset to 0 by completing a 34-hour restart. Does that all sound complicated? Yeah. But it does affect some of the sleep hygiene issues you need to teach truck drivers about. The biggest thing you need to know and understand about trucking is a DOT medical card. Any commercial driver, to be legal to operate in interstate commerce, needs to have both a valid commercial driver's license and a valid DOT medical card. DOT medical cards have both regulation and regulatory guidance to the medical examiner. So the regulation we're all dealing with is 391.41B5, which is part of the Code of Federal Regulations, an act passed by Congress. So if a driver has a medical history or clinical diagnosis of sleep apnea, they are not qualified to drive a commercial motor vehicle unless they are under current and effective treatment. Now, where the regulatory guidance comes in is that medical examiners have been given guidance that they are to screen drivers at a high risk for sleep apnea. So the current guidance is any driver with a body mass index greater than 35 needs to be evaluated for OSA via an objective test. And that's not specific whether that's an HST or a PSG. If they are at high risk for sleep apnea, they may be given a 60-day conditional medical card to continue work while they begin the treatment and evaluation process. But this is regulatory guidance. This isn't a rule or act of Congress. So right now, with trucking calls, we're in the no rule. In that, back in April, the FMCSA actually withdrew the Federal Register notice for the rule they were working on about sleep apnea. So if this sounds confusing, it is. So you will have drivers which will be resisting coming in, saying there is no rule that says I have to be tested. And right now, today, there is no rule that they have to be tested. There's other professions, too, that deal with these similar kinds of rules. Professional mariners, ocean-going, ocean liner captains, tugboat captains. They deal with a practical issue of the moisture damage to the flow sensors on their CPAPs. Think about clean water sloshing versus saltwater spray. Train crews, the engineers and conductors on freight trains especially, deal with moving that CPAP from the train to that crew van every day. Air traffic controllers and airline pilots are also subject to FAA flight physicals. And some of how these regulations affect treatment is prior to July 1st of 2011, less than 0.1% of air traffic controllers have been diagnosed with sleep apnea. Prior to July 1st, it was an immediately disqualifying condition for air traffic controllers, and there was no regulatory path to medical certification if they were treated. So a lot of my sleep test friends were reporting a lot of John Does and John Smiths who were getting sleep apnea polyphonographs and paying cash. Part of what may have been going on were air traffic controllers that knew they needed to get treated but couldn't afford to have any medical record of their diagnosis exist. Otherwise, they're out of work. So recognize this is some of what goes on in some of these transportation-related fields. So the first practical question we're going to deal with is where the heck do you plug in a CPAP in a 12-volt equipped truck? The other thing we've got to deal with is not only where do you plug it in, but how do you get enough power to run that CPAP and have some reasonable climate control for a full 8-hour period, which you should have while you're sleeping. The problem is, and I'll use the ResMed S9 as an example, set at 16, which happens to be my pressure, with moderate humidification, it draws more amperage hours than the rated battery capacity of a full-size, brand-new semi-truck at 70 degrees. And batteries don't hold as much power once it gets colder. So many drivers must idle to safely operate their CPAP unless their truck is equipped with an auxiliary power unit. Another issue that drivers deal with is that you can't use a CPAP in the full range of weather conditions that you might be able to sleep in. One of the problems I've dealt with, and I've counseled several other drivers that have dealt with, is when you try to sleep on a CPAP with temperatures below about 45 or 50 degrees, that cold air getting blown into your lungs through the CPAP overwhelms your body's ability to stay warm, and you end up with CPAP-induced hypothermia. Personally, I've woken up in stage 2 hypothermia where I stopped shivering and was semi-delirious, and I've talked to several other drivers that have woken up in stage 2 hypothermia. So part of the education I do to truckers is that you've got to be very careful how cold you try to sleep on your CPAP without heating the cab. So again, part of the idling problem is that there's many parts of the country that you cannot idle a large semi-truck. A good resource for drivers is the American Transportation Research Institute Compendium of Anti-Idling Regulation. Now, if I remember right, isn't the ASBA headquarters there in Utah?
Yes, it is.
It is. It is. Well, if I came to visit you, I can't idle my truck anywhere in the state of Utah for more than 5 minutes. So if you're treating truck driver patients in Utah and expect them to sleep in a sleeper berth equipped truck, one of their problems is they can't idle. Okay, so general power supply options. You can have a power inverter direct wired to the truck battery with a low voltage disconnect. We'll get into more detail. Or you can do a 12-volt power supply CPAP. There's several of them on the market. Or you can get into a portable battery setup. So let's look at the power inverters to start with. First hint is oversize the capacity of the power inverter. Most CPAP on the market are going to draw between 155 and 185 watts. Power inverters are more efficient if they're not being run at their maximum capacity. So yeah, you can run a CPAP on a 200-watt inverter, but if you spend a couple extra dollars to just get a slightly larger one, you're actually going to have less draw to the battery. You want to use proper wiring. Use the manufacturer's recommended installation kit. You do not want to be seeing drivers out trying to run a CPAP on an inverter plugged into the cigar plug in the truck. You're just dealing with a little bit too much 12 voltage draw for that to be a really safe mode of operation. The second thing that you need to understand is that power inverters either create modified or pure sine wave power. If you took the 110 volt power and put it on an oscilloscope, sine wave is nice, curves, modified is choppy blocks. in general, motors don't like to run on modified sine wave power. While all of the CPAP manufacturers currently approve their CPAP to run on modified sine wave, I've seen some problems with long-term use of CPAP on modified sine wave power inverters. Basically, you'll be buying a new blower motor after a year. So again, my recommendation to drivers is just put a little extra money into that inverter. You can get a 400-watt modified sine wave for about $44, $45. A good 600-watt pure sine wave is only going to be $169. When you're dealing with protecting a $800 or $900 CPAP, to me, that's money well spent. Second option is going to be to use a 12-volt direct power supply capable CPAP. And right now, there's 3 of them on the market: Philips Respironics Pro System, the ResMed S9, or a Transcend. Now, one of the problems with a direct 12-volt supply, basically you're going to plug the cord from the CPAP directly into a cigar plug, is that if it's got optimized idle, you're going to be dealing with that scrambling of the compliance data. Another thing the driver may need to research: many trucks, the cigar plugs have what's known as a load shedding logic in the truck as the batteries begin to discharge. Usually, one plug in the truck is designated as the primary power source and will be turned off last. Obviously, that's the plug you want to plug your CPAP into. They need to be aware that if they're running a S9 or a Pro System on a 12-volt plug, stock up on the fuses for the cigar plug circuit. You're running just about the max amperage draw for the wiring in the truck, so you need to be ready for problems and carry jumper cables. Because if that low voltage cutout on the truck is designed, it's designed to turn everything else but the starter off with enough juice in the batteries to still start the truck. If it doesn't work quite right, when you wake up in the morning, you're dealing with getting your semi-truck jump-started. So carrying jumper cables is a common sense issue. Okay, portable batteries. Don't even deal with plugging the CPAP into the truck battery. If they're thinking or going to do that kind of a power supply option, we need to make sure they're using AGM or glass pack deep cycle batteries. You do not want to use normal wet automotive batteries inside of an enclosed truck sleeper. You've got to remember that when those batteries are charged, they emit hydrogen, which is flammable when they're charging. You want to use either lithium-ion or NiCad batteries. And again, the photo there is of a Super CPAP battery pack. They're available online. You can get them. Now again, my issue is that the cost of one of those battery packs, I'm almost where I can buy a portable CPAP. So you've got to look at, and again, you've got to read the details. Charging a unit like that Super CPAP battery pack, you've got to have an inverter at 110 volt. They don't have a 12 volt direct charging system for that particular one. Also, to give you an idea, for a normal CPAP, an S9 or Respironics, you need a pretty hefty size lithium-ion battery to even have enough juice to run the CPAP only. No humidification for an 8-hour period. If you start adding humidification, that greatly increases the battery draw. Last option would be to look at a totally portable pack. The Transcend by Somnetics is new on the market. It's still being abused in trucks to see how well it works. But again, as you can see, the size of the PAP and batteries, this was designed for low voltage draw battery operating conditions. Okay, so we're going to go over 5 of the major PAPs on the market and some of the trade-offs for each one as they relate to being used in a semi-truck. Now again, the DeVilbiss, one of its advantages is its motor over humidifier design. It is the most resistant to sloshing damage to flow sensors when they're used in team operations. Now, the compliance data for the DeVilbiss is an alphanumeric code system that's entered into the DeVilbiss website. So it's fairly easy for a driver to get access to their compliance data. But again, one of the negatives is the motor over humidifier makes it top heavy. This is the only CPAP that I've used in a truck that I had to tie down on the counter. Another issue will be that this is probably the easiest of all the CPAP on the market for a driver to prepare falsified compliance data. And we'll talk about where that will come in a little bit later. Next one I'm going to talk about on the market will be the Fisher-Paykel series. Now again, I'm going to limit to the HC series. I haven't dealt with the newer Icons in a truck. One of their biggest advantages, they have a very open, easy to clean humidification system. They also have manual adjustment for altitude up to 9,000 feet. You've got to remember, long-haul over-the-road drivers can be at 500 feet in Green River, Utah in the morning, take lunch at 10,200 feet going around the Eisenhower Tunnel, and be sleeping in Denver that night. So that was an actual trip I did with a pre-CPAP when we were doing some high-altitude pressure testing. So again, that manual adjusted to 9,000 is an advantage if the driver is doing cross-country trips a lot. The Fisher-Paykel are pretty much bomb-proof. Of all the CPAP I've used in trucks, this is the only one I haven't been able to break. Now, you will need an inverter to run the Fisher-Paykel series. There is no direct 12-volt available. It's got a nice USB data stick compliance data system. And in fact, a vendor has a system where drivers on the road can stop at any Travel Center of America truck stop and through their document image scanning system can transmit their Fisher-Paykel CPAP compliance data back to their medical provider. Any of the other systems, you're going to have to be dealing with the driver getting access to the internet while they're over the road. That's an advantage. Another path that's a good one is the Philips Respironics System 1. Again, this is a top-of-the-line unit. It's got all the bells and whistles from exhalation pressure relief to humidification sensing, all of it. It's got a top exit hose, which I like. It tends to minimize the splash problems for teen drivers. It also has a direct volt power option. I haven't had any problems with the new System 1s, but in testing some older REMstars on optimized idle trucks, we had regular problems with compliance data. So again, if you've got a driver with optimized idle, think about that as a trade-off. Now, one of the ways around this is what's known as a bridging battery, and that's one. Email me after the webinar, and we'll get into how to design a bridging battery system to avoid optimized idle. The Philips uses an SD card for data compliance. That's very easy to mail, and it's a little bit easier for drivers to access. The only thing I personally don't like about the Philips is that the humidification chamber doesn't have a good way to pour out all the water in the morning. One of my little commandments in talking to drivers is, thou shalt dump out the water every morning. Okay, another path to talk about will be the ResMed S9. Again, it's a top-of-the-line unit, all the bells and whistles, nice 12-volt power option. Now, if the driver really needs lots of humidification and you're considering going with the Climate Line hose system on an S9, you need to recognize that that increases the power draw significantly. Now, you can run a S9 on the 12-volt power supply with the Climate Line hose, but again, you're up near the maximum draw that the cigar plug in the truck can provide to the path. So again, you're going to have some major power drain issues and battery issues running an S9 with a climate line. My personal experience is I don't need a climate line in the truck. The S9 humidifies well enough without the climate line that you may not need it. And the positive for the S9 is that it does have a nice drain hole in the water chamber. It's easy to dump and clean. And again, this is another stupid little thing, but as the Resbay came out with skins for their S9, I got a really nice diamond plate Harley logo skin for my S9. My CPAP doesn't need to look like a piece of medical equipment. I'm a truck driver. My CPAP looks like a truck driver's. Well, that's what we're going to talk about is the Transat. Now, it's new on the market, so it doesn't have a lot of practical use experience out in trucks yet. But it was designed to be a portable, low-power use CPAP. If you look at the size of the battery, that battery is designed to run it for a full 8 hours of sleep. Currently, they only market a CPAP only. They don't have an AutoPAP out yet. And currently, they're using a heat-moisture exchange system for humidification versus heated humidification. So for a driver which needs lots of humidification, this may or may not be the path for them. I just got one. I'm just starting to work with it and see how it behaves. So yeah, this is one to keep an eye on and kind of see how things work out with it. Okay, common problems that drivers deal with. Airphagia. And again, when I'm talking to drivers, we talk about the burps and farts. One of the issues for a driver's life is that while we are over the road, we deal with a 14-hour workday. Basically, 14 hours from when we started doing any work which had to be logged, we can no longer drive. We then must take a 10-hour continuous off period before we can start to drive again. That's known as a DOT break. The purpose of the 14 on 10 off is that you can get a hot meal and get a full 10 hours of sleep within that 10-hour period. The biggest thing to teach drivers is you can't eat that big meal just before you go to bed. You want to eat a small meal before you go to bed, get up, and if needed, eat that big hot meal for breakfast. Otherwise, you're going to get the burps and farts. Oral appliance therapy. One of the issues for a commercial motor vehicle operator is that the current interim recommendations to the medical examiners are not to allow oral appliance use. Now again, this is a current controversy in many of the medical circles, and it's been argued with the Federal Motor Carrier Safety Administration, but right now that's what the interim guidance to the medical examiners are. So again, really keep this in mind before you send a patient who is a commercial driver for an oral appliance. Same thing with surgical options. Again, the biggest thing the driver needs to be counseled is that if they decided to go with a surgical option, they need to budget for an annual polysomnogram or either a maintenance of wakefulness test or an MSLT. But they're going to have objective testing every year to provide to the DOT medical examiner to keep their DOT card. There have been some very major accidents involving truck drivers who had gotten oral surgery years ago and things had grown back so that they were back into untreated sleep apnea at the time of the accident. So this is a very sensitive issue with the motor carrier safety folks. So again, if they're going to do surgery, they need to budget that extra money for an annual PSG, and that PSG will most likely not be covered by their medical insurance. Other things to think about. Are you going to recommend or try out a nasal mask or a full face mask first? I really suggest if you're going to be working with truck drivers, get to a truck show or someplace where you can actually see what the inside of a sleeper berth looks like. There's a reason why we jokingly call them our coffins. Claustrophobia, I find to be a major component in some mask toleration problems when people are on full face masks. A lot of times it's teaching just a little bit, just a little ResMed assay. But again, one of the ways to help prevent water sloshing on teens is just take a bungee cord. Run the hose from the CPAP up over the bungee cord and down to you. It also prevents the problem of, if you roll over, wrapping the hose around you, pulling the CPAP off the counter. Another recommendation I have is that if you're treating drivers and you have the option to use APAP, I like to see an APAP with a narrow range of pressures set around your titrated pressures. I have major problems with the drivers I deal with, which are given an APAP set wide open and never heard from again. You want that narrow range of pressures to deal with both low battery and or altitude and pressure issues. The best experiences I've had while over the road have been while running an APAP with a 2 to 3 millimeter range around my titrated pressure. And again, there are wireless data compliance monitoring systems with remote pressure adjustment. Some of the best practices for new drivers on CPAP are to use these to allow you to do remote pressure changes. Okay, home sleep tests or portable monitoring versus polysomnogram. One of the things you need to think about is whether or not the driver is coming to you as a voluntary referral. Okay, they think they might have sleep apnea and they're coming to a medical professional to see if they actually do, or whether or not they're a regulatory referral. They have to get a sleep study to keep their DOT license, and they're coming to you kicking and screaming and probably using a few four-letter words. Because the common wisdom in the trucking industry among drivers is that sleep apnea is not really a problem. This whole regulatory thing has been thought up by the sleep medicine industry to make money on the backs of the poor truck driver. And you can tell I argue this a lot with my fellow drivers. Another issue with home sleep testing will be what's been called chain of custody. Is the person who actually took the home study the driver it was intended for? There are systems which have bands which are administered after when you pick up the HST. There's different systems, but that's an issue in trucking for home sleep tests. Another issue that you may run into is if you did test someone with an HST and they were marginal for being treated for sleep apnea. Some of the recommendations to the DOT medical examiners are when they do have marginal HST results to take them with a grain of salt. So you may see a driver sent back to you for a full PSG if the home sleep test was marginal. So again, that's just part of the regulatory nightmare drivers deal with. Drivers will also need to get an annual compliance data download. The best programs that I've worked with or dealt with is that you're going to get both a compliance data readout, a report, and a letter from the treating physician that the driver is under current and effective treatment. Current and effective treatment for a commercial motor vehicle operator is defined as a minimum of 4 hours of use 70% of the night. Now again, that's not a real good goal for CPAP use, but that's the minimum they have to maintain to keep their DOT medical card. Hence, get those compliance data done within 30 days of their DOT physical expiring, and get it done before that DOT card expires. A big help you can give to any commercial driver patient is to set up a reminder system. You find out what their DOT medical card expiration date is, and before it's due, you're contacting them to get a CPAP download. One of the questions and issues you have to deal with is if you have a driver who is not compliant on CPAP. Do you give this information to their employer? You've got to deal with, did that driver sign a HIPAA release? One of the major ethical questions you may get into once you start dealing with a lot of truck drivers is the balance between HIPAA and that patient's privacy rights and who is your client. because your business relationship will be with that trucking company, not the driver. It's just an ethical challenge that you may deal with. Nasal irritation or bottle brush nose. Sleeper berth air is bone dry. You've got to prescribe heated humidified air of some kind. My personal feeling is the CPAP to a truck driver should also come with a couple of cans of nasal mist and a bottle of nasal gel. To me, it's just common sense. I've used either or both products. Most of the time, I've been out in a truck on sleeper, on CPAP. Cleaning your mask and hose. Think about this truck driver's options are the bathroom sink at the local truck stop. Nah. In general, the best way to counsel your drivers to clean up this equipment is to take it in the shower with them. Personally, I just got it started out as a shotgun cleaning kit. I just use that, and it gets clean, every time I take a shower. If you're going to work with truck drivers, does your clinic have parking for an 85-foot long, 13-foot-6 tall, 80,000-pound commercial motor vehicle operator? It's kind of spectacular when we try going under something that's not quite tall enough. Give you some best practices that I've run into in working with drivers over the years. Again, I'm a big fan of polysonogram if it can be done with a commercial motor vehicle parking equipped lab. Many of the large firms that specialize in treating truck drivers, that's what they use. I'm a real fan of the driver giving an education on mask that he's fitted for a mask before starting the sleep study. A really good program, when the guy comes in, he's got a table with like 21 different mask styles. He would pick out his top 3 choices. If the study ends up being a split study, they use the first choice mask. If the driver doesn't tolerate that well, he leaves with a second and third choice mask. Again, polysonogram interpretation by the sleep physician to be required by 9 a.m. Basically, that driver doesn't get away from the lab before he knows whether or not he's got sleep apnea. You don't want to be dealing with a driver who is given a clinical diagnosis of sleep apnea with an AHI greater than 21. That's the current immediate disqualification standard. That's away from home or away from the lab. Most of the good programs specializing in truck drivers will also work out that if the driver comes out of the lab needing a PAP, in the morning he gets a PAP and is given training and familiarization. So basically the first night after the sleep study, he is on PAP. 12-volt power cords, or that there's some kind of a prearrangement that there's a local nearby shop that can install the power inverter. I'm a big fan of one mask style change at no additional cost to driver. Most drivers, even if the first mask they start on is what they live with forever, often want to at least try something else. Wireless monitoring, I'm a fan of at least 90 days on wireless monitoring. And again, that's a clinical decision back to you if you think you need to keep it going after that. And again, many of the wireless monitoring systems allow for remote changes in tap pressure. Big thing is, we're scared about losing our jobs. I'm going to give you an actual case history of Mike. Mike was a voluntary referral to treatment. I was actually involved with talking him into getting a sleep study done. He was employed by a medium-sized trucking company, but their insurance was a $2,000 deductible medical insurance. We were able to get him hooked up with a reputable HST where he tested positive for sleep apnea. I believe his AHI was in the 15 to 18 range. He returned home Thursday night to pick up his APAP, and unfortunately an APAP set wide open to begin with. Plan was to titrate him over time. He used his APAP Thursday through Sunday, returning to work Monday. He asked his driver manager about getting a power inverter wired into the truck he drove. Safety manager's answer was, it's complicated, I don't have to do anything, and fired the driver on the spot. Now, things have improved since that story happened a few years ago. The Equal Employment Opportunity Commission is becoming more actively involved with Americans with Disabilities Act discrimination cases in the trucking industry. Mike was fired in violation of the ADAA, and he ended up getting his job back with some fines and penalties, but it was after a long legal fight. Another whole issue is how do we screen the total driver population for sleep apnea? Right now, it's estimated there's over 1.5 million commercial motor vehicle operators who hold DOT medical cards that should be screened for sleep apnea. What process do we use for it? Well, this will actually, one that's available and out there that medical examiners have been encouraged to use were written by a joint task force on sleep apnea published in the Journal of Occupational Environmental Medicine back in 2006. So using those criteria, you have a 76-year-old driver, he's got a body mass index of 34.4. Well, every set of screening recommendations that come up has been 35. Under 35, drivers are not being required to get a sleep study. This person had a history of cardiac arrhythmias, but a recent stress test, so his cardiac situation was okay for medical examination, and the types of arrhythmias he was seeing were not typical of untreated sleep apnea. He would not report snoring, or did not report snoring, any excessive daytime sleepiness, or any other obstructive sleep apnea symptom. But study after study has shown drivers' self-report of symptoms to be a poor indicator of PSG results. Basically, drivers are going to lie. They're not going to tell a medical examiner the truth if they're facing having to get a sleep study, the potential for a month off work, and the increased medical costs. He also didn't fall asleep in the waiting room. That is also a flag for mandatory sleep studies. You fall asleep in the waiting room of the medical examiner. That's what ended up happening. A driver was involved in an accident in Miami, Oklahoma, in which 7 people died. Again, we talked a little bit about what the driver's feelings are about it, but sleep apnea is all because sleep doctors want to make money. Well, drivers' fears about how sleep apnea testing and treatment affect their job is a contributing factor to untreated sleep apnea being as large of a safety concern as it's becoming in the trucking community. But the problem we also deal with is how do we treat effectively the 50% of drivers who are owner-operators. Of those, about 30% have any health insurance. Of the 30% that do have insurance, most are of a limited benefit type where they probably won't cover the full cost of a PSG and a CPAP. My experience has been many drivers, the deductible on their insurance, you can actually do an HST on them and get them in a decent CPAP for less than the deductible on their insurance. Many carriers exclude sleep apnea from their coverage because of the cost and the percentage of over-the-road drivers which probably have sleep apnea. So the problem gets into who pays for all of this. Well, who really ends up paying is the trucking company in the long run when there are sleep apnea-related major accidents. Celadon Trucking recently lost a $3.25 million judgment where it was actually a landmark case in that the trucking company admitted the primary cause of the accident was the driver's untreated sleep apnea. A side issue in that case was that the driver had been tested but would not give the hospital which did the testing a HIPAA release to tell his motor carrier. Part of some of the issues in the court case, the trucking company tried to bring the hospital into the case and get them to absorb some of that judgment for negligence for not telling them. But again, the problems of you've got a driver who is non-compliant or refusing treatment for sleep apnea and HIPAA, can you tell the driver's employing motor carrier? Associated Wholesale Grocers, that was the case where I had the day cab up there. They paid over $26 million in damages on that case. So again, that's an idea of what you'll be dealing with when you start dealing with larger numbers of truck drivers as patients. That's all I've got for you.